I am here standing with the privilege of presenting a region, which is the Latin America and Caribbean region, that is not very often present in global meetings, but is working very hard to achieve the MDGs 4 and 5, and has some experiences that we believe that are worthwhile to share with the rest of the world. And I am also honored to represent a group of people, very passionate and dedicated group of professionals from agencies and organizations, and with whom I have worked in this effort for the last 7 years. And we really came to this being creative in response to the limited resources that we have for the region. So I would like to start by showing you that the Latin American Caribbean has great variation in the neonatal mortality rate. And these are estimates that I was a little surprised to find how high these estimates are. This is the WHO, UNICEF, and World Bank's estimates from 2012. But you can see what is important to see is that we have some very high neonatal mortality rates in some countries still, and we also have neonatal mortality rates that fit developed countries as well. The region has also achieved great reductions in the last over a decade, such as we have the countries in brown that have reductions of over 50%. Then you have in the middle countries that have had between 39 and 49%, and then you have countries that have much lower reductions and not exactly the rate that we would like to see of reduction per year. And we still have very high neonatal mortality rates. And you see countries such as Bolivia, Guyana, Haiti, Trinidad and Tobago. That was Bolivia the first. Jamaica was the first one. But we also, I think that the biggest problem in the Latin American Caribbean region is that these are the average data that really hide the huge disparities that we have in the region. This is a very diverse region. We have 20 countries and almost 400 different ethnic groups. And these average hide the disparities between and within countries, where you can have countries, as you saw, such as Cuba and Chile, that have NMRs of developed countries, but you also have countries that have very high NMRs that you see in other regions of the world. And you have populations that are very vulnerable and have very limited access to healthcare, such as indigenous, rural, and displaced population by internal violence that contributes to inequities. And these estimates are a little different because they come from a different source, but you can see, for example, in Bolivia, there's a region that has up to 52 per 1,000 live births, and you have regions like where the capital city is, where you have 17. And also we know in the region that the NMR is double in the poorest quintiles of income than in the richest. So you can see that we have not much better situations. In the Americas, we have the same, we're reflecting the same situation as the global in terms of what is causing the biggest mortality, not only in newborns with complications of prematurity, but being the second cause of under 5 mortality rate. And the proportion of premature births, again, is an average, and these are statistics from the Pan American Health Organization, which is the WHO chapter for the Americas, if you will. But you see the majority of premature babies, like everywhere else in the world, is babies that are between 33 and 36 weeks of gestational age. So these are the bigger babies and not the ones that are necessarily in need of very high-tech technology to survive. Now, in terms of skilled birth attendant, and this is an old graph just to illustrate the fact that we all know is that the neonatal mortality rate is lower in places where we have the highest skilled birth attendants, and Latin America, in average, seems to be in good shape. But if you go country by country, you can see that a country like Haiti has a high NMR and maternal mortality ratio because the skilled birth attendance is very low. You have Chile, which is a country of almost 100% of skilled birth attendance, and you have very low NMR and MMR. But you have some exceptions, for example, the Dominican Republic, where 98% of the deliveries happen in institutions, in services, but you still have MMR and NMR that are very high, and this is talking about issues of quality of care in facilities. And we have, of course, you all know very well that we have to look at those sides of the service provision. Breastfeeding in the Americas, we're not a great example of breastfeeding. I was looking at the Malawi statistics, and I was very envious to see how well they're doing in breastfeeding. We have all kinds of different data in the spectrum, and you can see that, for example, the Dominican Republic has exclusive breastfeeding for the first month that is only 20%. Of course, in the Americas, we, the United States, are not the greatest example, so it's there. When we talk about the Americas, we talk about North America as well. And when you have some countries that are a little better, this is a study that was done by Macro International, Dr. Alfredo Ford, who's currently in WHO, in 2007, and that brought back this issue that we know continues to be problematic. We also are dealing with the burden of fetal deaths. In many countries, stillbirths are not commonly counted in national information systems. They're also misclassified, and I talk a lot about these in Helping Babies Breathe trainings, where a baby that is supposedly a fresh stillbirth might have been possible to be alive after a little bit of resuscitation effort. And the estimation, we don't have, of course, we don't have the numbers exactly. It's almost 100,000 in 2009. So we're hiding also a big problem like everybody else. And in response to this, and this was a huge process of many years since 2005 of lots of people, the Latin American Caribbean Neonatal Alliance was born, which mission I'm of course not going to repeat, but is the mission that I guess everybody in this room has, which is to promote neonatal health in the continuum of care and to promote policies and programs based on scientific evidence. And we are focused mostly in the most vulnerable populations in response to these inequities. Now, this is what the Alliance looks like today, and I have to call your attention for a few highlights. You have in the top, and you might not recognize the logos, but we have the 4 professional associations that are relevant to newborn care, and that is the OBGYN, ICM, we have the pediatric, and we have the nursing association. So we are trying with this effort to keep the continuum of care very clear. We have the UN agencies, and we have many others. We have USAID with the flagship programs. We have the Kangaroo Foundation. I don't know how many of you know that Kangaroo was born in Colombia. We have the government of Colombia, which wanted to join the Alliance. It's one of our recent additions. And you have NGOs, and every day we have more and more people wanting to join this effort. Mesoamerica Health Initiative 2015 is also a huge one of our members. The strategic areas, this was a document that was produced, one of the first products of the Alliance, is to create policies, is to strengthen health systems, is to promote community-based interventions, and also a point that is very important to us is to improve surveillance and indicators and to measure what we're doing and what's going on. Some of the highlights, and this was the meeting that happened in Lima, Peru in 2009, where all the professional associations signed this memorandum of understanding with us. We have, what is important about this group is that we have a shared work plan. We're a small group of, I remember somebody calling it the working bees, and each one of the partners, if the partner has the possibility to put some fundings forward, that is going to be our budget, but also in-kind efforts such as technical assistance are always welcome. We have done several meetings to promote the creation or strengthening of national alliances that are a mirror image of the regional alliance. And we have had recently a very positive midterm evaluation of the strategy and plan of action for the region. And these are the achievements really in a nutshell. The regional strategy and action plan became a resolution of the Directing Council of the Pan American Health Organization. I think this was probably the biggest achievement to begin with, because we had ministers of health of almost 20 countries signing to make newborn health a priority. There is a website that you can see where you can access it, where we can share experiences and evidence-based interventions. We have been working in parallel with the Global Group for Newborn Indicators to recommend to the LAC region. We have been invited to be members of all the efforts that the United Nations is working on, commodities, and the Commission on Accountability and Information for Women's and Children's Health. And the most important, and that's why it's in red, after doing all this policy, all this advocacy, trying to influence the agenda of governments, now we have decided to go to the country level, where we provide technical assistance to countries in strengthening their work plan. Whichever, some countries have to develop it, some countries have to strengthen it, and the idea is that every partner that is in a specific country will take the responsibility to help the ministries of health coordinate these groups. And how have we been able to scale up, and being this the subject of this presentation, how we have been able to scale up some interventions in the LAC region, again, with very limited resources. So HBB is one of our best examples, where you can see in how many countries it is, and I have no idea how many others we don't know of, because our partners are everywhere, and we try to coordinate the efforts to support the Ministry of Health. I'm almost done, Alisa. We also have a network of kangaroo care, about which I'm going to be talking tomorrow. It was created in the Dominican Republic in December of 2011. It was our first regional meeting. It is supported by the Neonatal Alliance and also the Colombian Kangaroo Foundation, which is our gold standard for the practice. We have 10 countries already. There's a community of practice in the process of development. And we have our second regional meeting planned for June 2013, where we hope to have something similar for other newborn interventions, create a network of newborn care. Of course, we have had many challenges. One of them is the small and decreasing funding for the region. I think that this is probably the first time that you all hear about LAC programs. The newborn agenda, unfortunately, still is again disappearing, and I heard similar subjects with my colleagues. The funding for national alliances is a problem. I mean, the mechanism where everybody contributes their budget is still not there. And there are limited budgets in countries for newborn health still. Many thanks. We left outside, this is the memorandum of understanding with the professional associations, but we left outside some brochures and some bookmarks for you. So thank you very much for your attention.